compared to when I just got out of training, the practice of cardiology today has changed dramatically. More than ever, the healthcare landscape is very complex, and it's very important to guide us through the landscape. And that's why the college has tremendous initiatives in the area of quality and advocacy. Joining me now to look at this is Dr. Janet Wright. Janet is the Senior Vice President of Science and Quality, and Dr. Jim Fasules. Jim is the ACC's Senior Vice President of Advocacy, and they're both cardiologists, so they bring a good perspective to us. Thanks for joining us. Janet, let me start with you. The ACC has been very active in the arena of science and quality. What's popping in that area?
Right. A lot is happening in that area. The area of science and quality for ACC includes the guidelines, the performance measures, appropriate use criteria, health policy statements. Also quality improvement initiatives, several of which are national. We've been doing door to balloon for a while, and now hospital to home. And then finally, we've got 5 hospital-based registries and now the ambulatory registry Pinnacle.
So you've got a lot going on.
Right.
The national quality initiatives are a big deal, aren't they?
Exactly, because as local as many problems are, there are themes that go across the country. And a huge one now is this problem with inappropriate or avoidable readmissions. So we're doing a lot of work with other organizations across the country to make that a smooth and safe transition, hospital to home.
So, which is really a neat thing. Jim, on my lap is the January-February issue of Cardiology, and it has the top 10 advocacy issues in there. So I know there's a lot been going on. If I said not this isn't a Dave Letterman list, but give me the top 3. Give me the top 3 for 2010.
First off, there's a whole base of stuff that we do day in and day out, the regulatory, the appropriations, things like that. But and then of course there's the overarching issue of the Affordable Care Act and reform. The 3 issues, though, that would pop up as probably the biggest policy issues that we're dealing with are the SGR, which is the sustainable growth rate, adjusts the physician's payments. We need to fix that. Tort reform, and how do we use the quality measures that Janet's talking about to actually give a physician a higher bar that has to be cleared by the plaintiff for showing that he or she's done something wrong if you're practicing quality medicine. And the third one is the attacks on the stark in-office imaging, in-office testing under the guise of self-referral attacks. I call that the new boogeyman of fraud and abuse.
Absolutely. Let me ask you, you've seen a lot of changes, obviously, in the whole private practice and healthcare delivery arena. What's striking about that?
Well, what happened was the payment formula that was calculated for the adjustments to cardiology's reimbursement from Medicare for the 2010 year led to a significant cut, so that the private practice over a 4-year period is going to take as much of as 30% cut.
Right.
And this led to about 50% roughly of the private practices selling or integrating into the hospital.
Right. So dramatic. Every time we talk about this, I think is it cocktail hour yet? But because it really is, it's a tremendous shift.
Seismic shift.
You're seeing it. You must be seeing it in the whole quality initiative, aren't you?
Exactly. And in some ways, what this is doing is, as our members move into hospital setting for the first time in a long time, they have the luxury to actually consider quality, because their environment has changed so dramatically. So our job now, Jim and I work very closely together, but we're also linking up with our education resources at ACC to mobilize the incentives like maintenance of certification and maintenance of licensure, hook those up with quality improvement and performance improvement.
That's a big deal. Let me ask you, if you sort of look down the future or the next year with the college and each of your initiatives, what's going to happen? What's sort of going down?
I think that in tying this all together to some extent, one of the problems we're going to face is when a physician's office, they can put the quality initiatives in pretty easy. The difficulty is, can you convince the hospital to put the capital up to do it, and what's the return? So in tying that together with the Affordable Care Act is, if we're going into these accountable care organizations, will the physicians have enough leadership and management and not just be overrun by the hospital in that setting?
And in my area, linking up with that, our idea is to try to put forward a system of care so that we're able to capture the measures, demonstrate that our members contributed to the performance improvement, and then to link up their payment to that.
So that's really big. Jim, we're gonna close here in just a second. But what about the PACs?
The PAC?
Yeah. How big is that?
Well, the PAC, we actually have grown remarkably in the last 10 years. That we're now one of the top 10 for medical PACs. Still ways to go.
Right.
But what it has done is gotten us access into the offices, especially at the in-district offices where we actually can meet the congressional member and directly talk to them about it. And that's really what the PAC is geared to do.
So that's great. Well, I appreciate what both of you doing in science and quality and advocacy. Certainly it's key to our practice in the future. So thanks very much for joining us.
You're welcome.
Pleasure.